You're listening to Focal Point with Brian Fisher. Focal Point with Brian Fisher.
Hi, welcome back to the last segment of today's edition of Focal Point, this Wednesday edition of Focal Point on AFR Talk. You know, there's been a lot of controversy about the Uganda bill, and it's important to understand what is behind this bill in the country of Uganda. Now, it's a bill that prohibits homosexual conduct. It says in Uganda, homosexual conduct is contrary to public policy. And if you, for instance, if you take advantage of a child, if there is same-sex sexual abuse of a child, we're going to send you away for life. If you sexually abuse in a homosexual manner a disabled person, we're going to send you away for life. Now, why is Uganda so strong about trying to restrain homosexual conduct? Well, it's because this is a nation, ladies and gentlemen, that has been devastated, like many other African countries, by HIV/AIDS. For them, this is a public health issue. You know, it's really no different than what the gay activists did out in California, where they enacted an ordinance that provides a penalty, including possible jail time, for any producer of a pornographic film who would allow, and again, we're in PG-13 territory, by the way, here for this segment, so you may want to shield tender young ears, but this was gay activists did this in L.A. County. They said you can't have an actor in a gay porn film, or a straight porn film for that matter, who doesn't use protection. You do that, you're going to get fined, because we care about the health of our porn actors and our porn actresses. Well, you know, my view has always been, why should we care more about the sexual health of people who get paid to have sex? Why don't we care as much about the people who have sex for free? We ought to be as concerned about their sexual health as we are for anyone else. And so the gay activists out there in L.A. actually passed a law that prohibits certain kinds of homosexual behavior for public health reasons. This is what Uganda is really all about. We had an opportunity to screen a pretty powerful video this morning at AFA. Our whole staff watched it. The title of the video is Cultural Imperialism, talking about the effort on the part of the West to impose our sexual mores on a country like Uganda, and the sexual rights agenda of people like Hillary Clinton and Barack Obama when it comes to Uganda. Here are 3 clips from this movie, Cultural Imperialism, talking about, I'm sorry. Let's go to clip 10 first. You're right, Rob. Thanks for reminding me of that. This is Jen Psaki to give you an illustration of where this administration is at on what Uganda is trying to do to protect the family, protect natural marriage, and protect sexual health. Jen Psaki of the State Department.
The statement from him expressed our deep disappointment in the enactment of the anti-homosexuality bill in Uganda. For the 4 years since the bill was introduced, we have been crystal clear that it blatantly violates human rights obligations. It also made clear that now that the law has been enacted, we are beginning an internal review of our relationship with the government of Uganda to ensure that all dimensions of our engagement, including assistance programs, uphold our anti-discrimination policies and principles and reflect our values. So I'm happy to check back and see if there have been other calls that I'm not aware of since I've been done.
When the Secretary says an internal review of our relationship, does that mean something like cutting aid as the Dutch government has done today, or recalling the ambassador, or even sanctions? What would that specifically mean? Just
because this just happened, the review means a range of things. I don't want to outline all the specifics at this point, but it means we're considering a range of steps.
Including those 3 things?
Sure, certainly.
Okay, so here's Jen Psaki speaking for John Kerry, the Obama administration. Look, we're going to bully Uganda. We are going to bully them into submission. We represent big gay. We are bullies. We are bigots. We are going to browbeat you into submission. If you won't get your mind right, we're going to bully you into compliance. We'll recall our ambassador if we have to do it. We'll cut you off at the knees. We'll cut off financial aid to Uganda. We don't care how starving your people are. We don't care how many people need health aid. We're going to cut you off at the knees. We're going to cut off aid until you get your minds right on homosexuality, and we may even impose sanctions. We may even try to directly harm your economy because you're trying to protect the family and the sexual health of Ugandans. That's the nature of the administration that we are dealing with. Here are three excerpts from the video, Cultural Imperialism. Clip number 1. Let's listen.
The AIDS pandemic is one of the most serious crises the world has ever faced. Since the beginning of the epidemic, more than 60 million people have contracted HIV, and nearly 30 million have died of HIV-related causes.
Both my mother and father died of AIDS when I was really young. I also had to watch my brother die of AIDS. It was slow, painful, and awful. He was the one that took really, really good care of me after both my parents died. And I really miss him.
With close to 34 million people in the world now carrying the HIV virus and an estimated 2.7 million people newly infected each year, it's clear the world has not figured out how to stop this disease. So why, despite the billions of dollars being poured into AIDS prevention, have infection rates not significantly decreased? Dr. Edward Green, while director of the AIDS Prevention Research Project at Harvard, set out to answer this question, and the international community did not like what he found.
If sexual behavior is changed in the direction of more monogamy and fidelity and more abstinence, it greatly brings down infection rates.
In Dr. Green's book, Broken Promises, How the AIDS Establishment Has Betrayed the Developing World, he says the research shows that the sexual rights approach to AIDS prevention, championed by the UN and Western donor countries, may actually be increasing the rate of infections, not bringing them down. And if he is right, millions have died unnecessarily.
And the point here is that what the United States is doing and trying to impose on Uganda is the solution to this problem is condoms. But this Harvard researcher found out that the more condoms you distribute, the more HIV/AIDS infections you get. And it just makes sense. It's a way of encouraging sexual activity, sexual experimentation, sexual promiscuity. That's what a condom, that's the signal it sends. It's okay, go ahead and knock yourself out. Condoms don't work all the time. And so it just contributes to an increase in the HIV/AIDS rate. And this Harvard researcher says, look, the solution to bringing down the rate of AIDS is monogamy. It's getting people married and maintaining fidelity, abstinence before marriage, fidelity after. That's how you bring down the HIV/AIDS rate. It's behaviorally induced. It can be behaviorally restrained. Here's clip number 2.
Recently, there was an announcement both by David Cameron and by President Obama that, you know, they are willing to cut off aid to countries who do not recognize LGBT rights. No, we want to object to that as just being manipulation. Downright manipulation to get us to accept something, a lifestyle which is proven to be scientifically unhealthy, a lifestyle which is contrary to the religion and cultures of most of our people. We take great objection to this type of manipulation, and we wonder if the American people are aware of what is happening.
You know, and I would say that the answer is no. If you don't listen to something like Focal Point and AFR Talk, you do not know the truth about HIV/AIDS and the link to homosexuality. We've talked about this before, but you go to the Centers for Disease Control, and somewhere between 60 and 70% of all of the males who have ever contracted HIV/AIDS in the history of the epidemic got it through having sex with other men. This is the males who had HIV/AIDS. And another 20% roughly got it through having through intravenous drug use. So that's 90%, 91% of all of the males who ever contracted HIV/AIDS contracted it through having sex with other men or through intravenous drug abuse. Both of those represent a harm to public health. Both ought to be restrained. Both ought to be contrary to public policy. Here is clip number 3.
Uganda has also recently come under heavy attack and criticism about its policies on homosexuality, and I think a lot of it is based on misunderstanding. Coming from a country where we have seen our loved ones die from HIV/AIDS, seen the suffering, the toll that such illness bears, not just on the affected individual, but the family, the society, our whole economy is suffering. And it is our deepest belief that we owe it to our fellow Ugandans to put the right policies in place. And homosexuality erodes the very, very fabric of our society in the sense that it puts our people at risk.
Dr. Rand Stoneburner, he worked for the World Health Organization and he was all immersed in the Uganda data. But Stoneburner said that history will look back on this period and say one of the great abuses of the latter part of the 20th century is a failure to do AIDS prevention in ways we know are effective.
If we learn anything from Uganda, then what these nations look like in the future will be decided by the choices their young people make today.
But I'm not a virgin anymore. What's the point? I could just go on. After all, I've lost it. I got to know about secondary virginity. I say I may have lost the first, but I can keep myself from now till marriage.
Young people decide, and many have against premarital sex, and they know that abstinence works. And they're proud to speak about it these days because they know that their lives are different.
I was tempted, I tried it out. It wasn't what I thought it was. I wanted more and more to get what I thought I wanted. But I realized the greatest sex comes when someone really loves you. And if someone loves you, then they want to be committed to you. And that is only in marriage.
One of the voices you heard there toward the end of that cut was the First Lady of Uganda, talking about how important it is that sexual energy be channeled into marriage in the country of Uganda. And our cultural imperialism, there's a colonialism to detest. American colonialism, sexual colonialism, cultural imperialism in the country of Uganda. Well, that is it for today. Don't forget to bow low before God, stand tall before man, stand in the gap, and never forget we are fighting with God's help a winnable war. See you back here tomorrow.